February the 6th, potentially biggest NHS strike in history. Are you confident it can be averted? Are you, between now and then, what can you do to get around the table with the unions to get this strike called off?
Well, we were engaging with them last week. My door, as I've said throughout this, has been open. We want to work with the trade unions. We recognise that the NHS has been under significant pressure, particularly with this massive spike in flu. 100 times more people in hospital admitted for flu compared to last year. A very sudden increase, 7 times more flu cases in December compared to November. That, on top of COVID, on top of the legacy of the pandemic, has created huge pressure on the NHS and huge pressure on NHS staff, and we absolutely recognise that. That's why we accepted in full the recommendations of the pay review body, and we want to work constructively with the trade unions in terms of this coming year's pay review process, recognising the pressures on inflation and recognising the pressures on the NHS.
Is there a deal to be done between now and February the 6th?
Well, I want to work constructively with the trade unions in terms of the pay review body process. Those are the discussions we have. That is a constructive way that I and other ministers are engaging with our respective trade unions. But ultimately, we need to act in the interests of the patient. And the £6.6 billion that we announced at the autumn statement for the NHS, on top of the £7.5 billion, the biggest ever funding increase for social care of any government, is about listening and hearing to what the NHS have been telling us, which is we need to address this issue of those who are medically fit to discharge from hospital. That creates the blockage. That's about getting social care working in an integrated way with the NHS. That's why we put that £7.5 billion of extra funding in, and getting the capacity into the hospitals so we can do, as we're doing here at Northwick, which is get that triage into the emergency departments so we get the patient to the right point in terms of their care.
Well, final question, let's talk about the patients. The government estimates that tens of thousands of people, of treatments and appointments are being missed today. Tens of thousands more, presumably in February as well. This is seriously damaging all sides, isn't it? Government, patients and the NHS.
Well, that is why the trade unions need to get round the table, engage with the pay review body process, look at what is affordable in terms of the wider economy, the pressures on inflation. What matters most, not just to NHS staff, but all staff, is that we get inflation down. Because inflation cuts across the cost of living for NHS staff, social care staff, but people across the economy. So we need to get that inflation down, engage with the pay review body process, work constructively together. That was the spirit that we had discussions last week. I'm pleased that trade union leaders themselves recognise those discussions were constructive and collegiate, and we want to work with them, but the right approach is to use the pay review body process this coming year in terms of looking what is affordable, both for the NHS but to the wider economy.
And message to patients who've missed appointments today?
Well, we're focusing that £6.6 billion on how we get those elective backlogs down. We hit the first target, the first milestone in the summer in terms of the 2-year waits. That contrasts with Wales, where there's over 50,000 people waiting over 2 years. So within the English NHS, we've been driving down those waits. We did that with the first milestone in the summer, getting those 2-year waits down. We're now focused on the 78-week target as the next step in that plan. We have a clear plan to address the elective backlog, and that is what the additional funding we're putting in is focused on.